I can guarantee you this man knows more about anticoagulation than anybody I know. He's an assistant professor of medicine and the medical director of our anticoagulation clinic. He did his medical school at Damascus University, residency at Providence Hospital in internal medicine, and 2 fellowships in vascular medicine at the Cleveland Clinic and cardiovascular medicine at Michigan State. Dr. Shamoun, thank you.
All right. Well, thank you. Thank you. I don't know if you saved the best for the last or the last for the best. I don't know. So I'm the last one here, right? The one holding you up from leaving the room, right? I'm the very last one. David, can you display my 350 slides, please? No, seriously, they're not that many. All right, well, welcome, and thank you again for inviting me. We are going to talk about anticoagulation today, and the topic I chose was case-based anticoagulation. So I have no disclosures. My objective is to discuss with you how many anticoagulant and antiplatelet agents are available. This is going to be a rapid-fire slide, but after that we'll slow down a little bit, talk about perioperative management, and we'll review a case, a fun case in detail, and we'll close the session after that. So these are true cases from my practice. Let me know which one you feel is complicated. A 54-year-old with multiple DVTs on one of the newer anticoagulant and aspirin who landed in the emergency department with an acute abdomen. And of course, you have to manage the anticoagulant for them. 72-year-old with a history of atrial fibrillation has had multiple TIAs in the past every time she stopped the anticoagulant, and recently diagnosed with colon cancer. She needs chemotherapy, her platelet might drop, she becomes nauseated, she doesn't absorb the meds very well, she needs surgery, she needs management of the anticoagulant in the perioperative period. Or a 68-year-old with a history of diabetes and had a stent in his heart on aspirin and one of the new antiplatelet agent called ticagrelor, who landed in the emergency department with massive nosebleed. So, and this is not a, these are not a question cases, just kind of review to you some of the questions that I get called about. I put them up there. So managing anticoagulant and antiplatelet in the current era is really difficult and requires some expertise. So I think all of them are complicated cases. So this is going to be the fastest 4 slides. After that, we'll slow down. So just bear with me. There are a lot of anticoagulant and antiplatelet agents up in the